Could be a link between COVID and diabetes in children, and tonight doctors are trying to learn more about that. ABC4's Kayla Baggerly live in Murray with the details. Kayla.
Glenn, primary children's doctors tell me that they saw about a 25% increase in children with type 1 diabetes in 2021, and they're doing research to better understand if there's a link to COVID. I also spoke with one mother that said her 2-year-old daughter catching COVID changed her life. Mallory Rogers says that her 2-year-old daughter, Addie, got COVID within a week of starting daycare.
We had done everything right. We had listened to the professionals. We had isolated. We got vaccinated. And we waited until everything seemed to be clearing up.
Addie had a cough, but seemed to have a mild case overall. A week later, Mallory and her husband noticed some strange symptoms. Addie needed her diaper changed constantly and seemed to be drinking more.
And how quickly that change happened between her being a healthy toddler and her being very, very skinny.
Mallory, worried, took her to the doctor.
And the on-call pediatrician listened to me list off the symptoms and thought that it might be a yeast infection.
Despite treatment, she didn't seem to be getting better. So Mallory took Addie to another doctor that said she needed to go to the emergency room, where they learned Addie had type 1 diabetes. A study from the CDC shows that children who were infected with COVID-19 were more likely to develop diabetes than those who weren't.
They found anywhere from a 30% to 150% increase in diabetes in children.
And Utah doctors are trying to learn more about this connection too.
Approval to participate in the national study to explore this further.
Dr. Rahman says COVID-19 could trigger diabetes by targeting cells in the pancreas, affecting insulin production.
Now she is going to have this diagnosis for the rest of her life and be taking insulin for the rest of her life.
Doctors say it's important for parents to know the symptoms of diabetes, such as loss of appetite and excessive thirst, and make sure that they take their child to a doctor if they notice anything strange. Reporting live in Murray, I'm Kayla Baggerly, ABC4 News.